you want to get started?
Yeah, sounds good. So welcome to Free Information Resources for Health Professionals. I am Gina Genova. I am one of the clinical librarians at the University of Louisville's Kornhauser Health Sciences Library. And with me is Riley Sumner, and she manages Roundtree Library at the University of Louisville Hospital. So in this session, we are going to go over places to find free clinical guidelines, scientific literature, and additional reference material that might be helpful for clinicians. And then Riley will provide a brief demonstration of searching PubMed, which is a good place to find some of the scientific literature. And then we are also going to give a quick overview of Medline, which is a really useful resource for patients. And on the right here, this is not an evidence-based practice session, but we do want to quickly mention the evidence pyramid, and different kinds of studies. So when you are searching for information, it's always a good idea to look first for things like clinical practice guidelines and recent systematic reviews. And then if there are any of those things on the topic you're looking for, thinking about which primary studies are the most rigorous, for example, looking for randomized controlled trials over more observational studies. So first, some places to find clinical guidelines. So 3 good sources are the ECRI Guidelines Trust, NICE, and the CDC Stacks. So the ECRI Guidelines Trust collects various guidelines from around the web. The majority of them are free to access, and registration is required to access the database, but it is free and they have never sent me any emails at all. NICE is the UK's National Institute for Health and Care Excellence, and then the CDC Stacks collects the guidelines that have been produced by or in collaboration with the CDC. So here is what the ECRI Guidelines Trust looks like, and of course that is the URL up top in case you want to look at it later. So the homepage is on the left, and you can either enter search terms for guidelines, or you can browse guidelines by clinical area, like addiction medicine, cardiology, other things like that. And then on the right is what search results look like. As you can see, it's a fairly standard results page with a list of results. And on the left, you have a variety of filters, for example, date and whether or not the guidelines come with scorecards. And this is what a guidelines page looks like in ECRI. It includes the full guideline text, as well as a link to the original guideline. And some of their guidelines also have trust scorecards, and these are produced by ECRI to evaluate the guideline methodology and transparency. Because of course, even though guidelines are considered the highest level of evidence, sometimes different guideline teams use different methods, and they do end up being of varying quality sometimes. So the trust scorecard can help with that. And then this is what NICE looks like. Same as with ECRI, you can either enter search terms on the search bar on top, or you can browse guidelines by category, but instead of clinical areas, they use broader categories, like whether you're looking at different conditions or lifestyle guidelines. Their search results, again, very standard. They have their filters on the left and a list of results in the center. And this is what their guidelines look like. So they just basically the full guideline text, and you can also download PDFs if you want. Then for CDC Stacks, this is a little more complicated because there is not a convenient link to their guidelines collection. So if you go to CDC Stacks and then click the collections drop-down menu, select guidelines and recommendations, and then click search, that will take you here. And there are 801 results. Luckily, you can narrow that. The search bar on top, if you enter search terms, will only search within the guidelines collection. And there are also some filters on the left that might be helpful. And of note here, the listings, they include, of course, the authors and the publication date, like it would in any standard listing, but they also include the status. So you can tell right away if it is a current guideline or if it has been retired or superseded by a new guideline. This is what their guidelines look like. The guideline text is in a PDF pane. You can also use a download link if you want to save a copy. And then there is a details tab at the top that includes more details on the guideline. And now we're getting into where you can find original studies and other scientific literature. So, and one place is Pubmed Central. So this is almost like a subset of PubMed that includes articles that are contributed either by participating journals or by researchers who are fulfilling public access requirements for NIH-funded research. And I'm not going to touch very deeply on Pubmed Central because it's actually, in my experience, easier to find their articles through the PubMed interface and then use a filter than it is to actually search in Pubmed Central. So that'll be a little more covered in what Riley does later. There's also CDC Public Access. They host articles that are produced by or in collaboration with CDC researchers. And the Directory of Open Access Journals provides a platform to search journals and articles that are published open access across all disciplines, but I'll show you how to filter it down to medical journals. This is Pubmed Central. As mentioned, you can search in Pubmed Central, but I usually prefer to search through PubMed and then use the links to Pubmed Central there. This is what a Pubmed Central article looks like. The full article text is displayed. There are download links at the top right. And below that, there are also links to similar articles in PubMed. However, do keep in mind, because these are PubMed articles, they are not all freely available. Some of them are, some of them aren't, but that is just something to be aware of if you are using that tool. So at CDC Public Access, you can go back to the main Stacks site, and this time under the All Collections dropdown menu, you would just select CDC Public Access and hit search for that. And then basically looks the same as the guidelines one. However, there are many more articles here than there are guidelines, so I would definitely recommend using the search bar at the top to try to narrow that down, and then maybe the filters at the left to further narrow things by subject or date. So here are examples of 2 ways to narrow that. So on the left, it shows applying a subject filter, which can be found lower on the left. And then on the right, it shows what it would look like if you type something into the search bar. As you can see, it looks pretty similar. It doesn't change the interface. It's just depending really on what you're looking for, or which one you would want to use. And of course, the article pages in the CDC Public Access site look the same as their guidelines and recommendations. You have the full article text displayed in a PDF viewer, download link at the top right, and the details tab if you want more information. And now we are getting into the Directory of Open Access Journals. So you can search either for journals or articles, and you can do that either by entering search terms. And so you can toggle whether you're searching for journals or articles there on the left, or you could use the search drop-down menu on the top. And if you click one of those, you will be taken to a complete list of every journal or article. I somehow combine those words, depending, of course, on which one you click. So searching for journals, this is here, their complete list of journals. You can see they have over 16,000 of them. On the left-hand subject filter, you can filter that to medicine. However, that still leaves over 3,700 journals. So even then, it's probably a good idea to use either like the lower subject filters you can see on the right, that has some medical subfields like dentistry, gynecology, oncology, or to use the search bar to search for specific subjects or areas that you're interested in, because 3,700 is a lot. Another way to narrow results here is to use the English language filter, because a large number of the journals indexed here are not in English. So many of us only read English well enough to read medical literature in it. That might be a good way to filter that. Or if you have 2 or 3 languages, just select those 2 or 3. So this is what a journal page looks like in DOAJ. There is a toggle for articles from that journal that are included in DOAJ. However, not every journal has their articles indexed. So this brain disorder is actually, that tab is empty for this one, but it's not for every journal. However, there's also links to the journal website where you would be able to access all of the article full text. There's also publishing and copyright information, because this directory was actually originally created for researchers who want to publish open access. So that there's a little more geared towards that original purpose. Searching for articles here. The search function works the same as it does for journals. There are lots of these filters on the left-hand side that you can use to narrow your search, and there's also the search bar on top. And then this is what an article looks like. It only includes the abstract text here. So if you want to read the full article, you have to click the link to go to the journal's website and read it. And then they also include the journal information on the right. All right, and here finally we have just some additional information resources that are really helpful. So one is Nih Publications. This includes a mix of clinical tools like guidelines and care checklists, as well as patient handouts that you can provide to your patients. The NIH Drug Information Portal needs in-depth information on a variety of drugs and supplements. And then the CDC Travel Health Portal includes many clinician-oriented resources on travel health topics. And Clinicaltrials.gov is a directory of ongoing and completed clinical trials. Some of them include results. So this is NIH Publications. So here it's important not only to enter a search term, but to also to use the drop-down menu to select the health professional's publication type, because there's a lot of more consumer-oriented material in here. And then you can also search for specific publication years or institutes that produce things if you're getting too many results or if you kind of know what you're looking for. This is what the search results look like on the left, and then what an individual page looks like on the right. These are pretty sparse. It will only tell you basically information about the publication and then a link to it. So there's no like preview text or anything. You have to click the link to learn more about it. Now, the drug information portal is very straightforward. Just type your drug into the search bar. You can also, if you're looking for a specific class of drugs, you can toggle to by category and look up things like NSAIDs or other kinds of drugs. And then you see on the right, there's a very long list of things that are covered. A lot of it is, of course, summary drug information, effects on breastfeeding and liver toxicity, links to ongoing clinical trials with the drugs, searches for scientific literature on the drug, and related things. So pretty much anything you could ever want to know about a drug is going to be in this portal. And then the CDC Travelers Health page. This is just a web page with a lot of helpful links. However, it is for travel health concerns, very useful. This is a one-stop shop for information on recommended travel vaccines, pre-travel discussions with patients, finding travel clinics, learning about specific travel-associated diseases, and finding health notices for different destinations, and information on conducting post-travel evaluations if a patient comes in with a health concern after travel. And finally, we have clinicaltrials.gov. So this is a very large database. You do have to search it. You can search terms related to the condition you're interested in, the intervention you're looking at. So for example, the drug or therapy, or you can look for both. And then this is what the results page looks like. You can see on the left, of course, there are filters to refine, and the results information include things like the title, the conditions and interventions studied. And really helpful on the left is the study status. So if your patient is interested in participating in a clinical trial or trying a new treatment, you might want to look for something that is recruiting or active. Whereas if you're looking for more information on something that is completed or has results, might be more useful. So this is what a trial record looks like. The main body includes basically all of the information about the trial, what the study design is, what their outcome measures and eligibility criteria are, how to contact the research team, links to any publications that resulted from the trial. At the top right, you have status information. So if it's completed, if it's ongoing, if it was terminated, and the dates that these things happened. And then you can see there on the tabs, kind of in the middle, right above the main text, if results are available for the study, you can tab over to those. And now I'm going to stop my screen share and turn things over to Riley, and she'll give a quick introduction to searching PubMed.
Okay, thank you so much, Gina. So like she said, I'm going to go ahead and pop into PubMed really fast. This is going to be a very basic demonstration. PubMed is a free resource that you can access from anywhere. So it's not like you have to have a subscription service for specific people. I know we have some University of Louisville Hospital folks in here, and then we also have some folks from Peace and Mary and Elizabeth. Unfortunately, right now, only ULH staff can get access to any articles from PubMed or CINAHL or anything from me. Everybody else, this is just kind of for you to learn how to use PubMed, and hopefully we get our contract signed so we can promote these services to you and I can help you get these articles. But just real quick, very basic. And I'll go over a little bit more on how you can access these articles at a different location, but we'll get there in a minute. So I'm going to go ahead and share my screen and go into PubMed. Okay. All right, so this is what PubMed is looking like today. Some of you guys might have used PubMed with its old interface, or it's been a while since you guys have seen PubMed, but it's more user-friendly. It has a nice little facelift. So what PubMed is, it comprises of more than 32 million citations for biomedical literature from Medline. So this means that we do have all sorts of articles in there. That's basically anything science-based. So we have anything from vet stuff, we have some chemistry stuff in there, but really it's all medicine, medical database. And PubMed also takes, or how they do their searches is they don't use Boolean operators like we might be used to when we're using any CINAHL products or anything from EBSCO. I kind of equate it to doing like a Google search. So you're going to have your keywords, but you're not stringing them together using and or. We're just typing them in. So it's really straightforward. All we're going to do is type in our keywords. So what's a big topic right now has been hand washing, oddly enough. So we're going to do some hand hygiene, and we'll do, and it's searching for me, which is lovely. But if we do hand hygiene, healthcare professionals, compliance, we're going to do a search. And what PubMed is doing, it's behind the scenes, it's grouping these into terms for us so we don't have to worry about doing it. And it's going to do our search. So we don't have to worry about those Boolean operators, but you'll see we get over 950 results, which is awesome. One thing that I do teach is when we're doing our searches, we do kind of want to get as much information as we can first, and then we're going to filter down from there. So you'll see on the left-hand side, we have all of our amazing filters that PubMed offers. We have this English and humans filter that I've made for myself, just as a general thing, because like I said, they do include animal studies and veterinary information. So I do kind of like to get that taken from right off the back. And I do only read and speak in English, so I filter to that. We also have this really great little graph that's interactive and fun, gives you a little bit of little spice when we're doing our searches. As we know, most information when we're doing our research or evidence-based practice, we need things within the past 5 years. So we can narrow it down to 2016, 2017. The other great thing that I love about this little search bar is that it tells you per year how many articles have been published on that topic. So in 2021, they're telling us there are 43 articles from 2021. 2019 was a big year, 95 articles there. So you can just kind of narrow it down to that specific year if you'd rather focus on that. Or we can open it up to all 5 years that we want. Scrolling down a little bit more, for my people who aren't affiliated with the University of Louisville Hospital specifically, filtering down to this full text, free full text is a great feature. This is where we're going to get our PMC articles or anything that's open access. So Gina touched on Pubmed Central a little bit earlier in our presentation, and you'll see in these articles right here, we have this little orange text next to this, and it says free PMC article. That means that we have that article for free. It's in Pubmed Central. So if we click into that, also, I'm sorry, my dog just decided she needed to drink so much water. So I'm sorry about that. But so once we click into the article, we can see on the right-hand side, we have this PMC free full text. So we're just going to click on that. And just like what Gina showed us earlier, well, they're giving me this fun little, this is new. Let's see. Well, mine's never done that before, so that's interesting. I'm just going to type it into PMC to show you. This is what it should do. It should bring, all right. So it's either going to bring you to this page that it did here, where it gives you kind of the whole writing. You can also download it up here with the PDF. Oh, article and classic group. Okay. Interesting. Okay, so you can switch it to the classic view, which is what Gina showed us earlier, or you can read it in that fun textbook. I think it's in the pub reader is what it was set to for some reason. But it tells you right here all of your information, what its PMID number is, abstract. You can download the PDF right here. So for my people who are only affiliated with the University of Louisville Hospital, you can get any articles through me. So just send that citation to me and that's totally fine. But for my piece, Mary Elizabeth Jewish folks, narrow down to that free full text and those will pull those PMC articles for you. A little bit further down on our filter side, we have some article types. So we have this clinical trials, meta-analyses, practice guidelines, randomized control trials. If we go back to the pyramid that Gina was talking about earlier in our presentation, we'll remember that our highest level of evidence is our practice guidelines, systematic reviews, meta-analyses. So if we really want to focus in on high quality levels of evidence, you can use these to narrow down your search results, especially if you get a large number of results. They also give you another publication date. So if you want to do it within 1 year of 2021, you have that custom range. We also have some additional filters. So if we click into here, it gives us a whole lot more of article types that we can go into. So if we only want to focus on case reports, maybe just clinical trials, let's see. I'm going to add in just this guideline right here and a case trial so I can, or a case report so I can show you something here in a minute. For species, you can add in humans or other animals. Like I said, we get some vet stuff in here, so you can add that one. Language, they give you a very broad range of languages to choose from. You also have sex, so you can choose between male and female. Subject, journal, we do have those nursing journals that you can narrow in on. So if we have nursing specific folks, you can focus in on your nurse specific journals using this filter, which I'll go ahead and add in. And then we also have a very comprehensive age filter range too. So if you want to focus on a specific patient category, we can filter by age. So if you noticed, I was clicking on a few things in those additional filters. And what that's going to do is when I hit show, they're going to populate on the left-hand side here. They're not going to automatically be applied to our search results, so we will have to add those in. So if I want to hit focus on nursing journals, I'll go ahead and add that in. It gives us 38 results. We can do the free full text, see if anything pops in, and then we get 6 free results from there. Okay. One thing that I do want to show you while we're here is I do recommend creating a My Ncbi account. So I'm already logged into mine, but I'll go ahead and show you what it looks like. With an Ncbi account, this is free. It's not related to anything for the hospital or the university. It's something that the National Institute of Health allows you to create for free. So I use it to put in different collections when I'm doing my searches. So over here in my collection area, we have a few collections for literature searches that I've done. So I can go into these and see what articles I chose for that specific collection. So for this maternal mortality, if I click into that, it's going to take me back to that collection that I chose, that I originally did my search on, and I can go back and review those articles. So it's a really great resource. I highly recommend getting it. And I'll just show you how to add in your articles to your collection. So once you're logged into your Ncbi account, you'll have this little screen up here that tells you you're logged in. So if we really like this article for a specific collection, we can check mark them as we go. And then we're going to do this send to button right up here and go to collections. and you can create a new collection or you can add it to a new collection, and you'll see all of my collections pop up. So I don't know if I have a hand washing one. I'm sure I do, but I don't feel like looking for it. So you can add to a collection or create a new collection. We'll do hand washing demo. We can hit add. They say they've been added. You can edit your collection when it gives you that. And then you can go in and see what articles are there for you. Okay. So another thing I want to show you while we're in PubMed is if we click into an article, it gives us quite a bit of information that we can use for potential searches. So we get just the basic information, our citations, what their PubMed identification number is. You get your abstract. They also give you similar articles, which PMC does the same thing. But the other thing I really like about this is they also have that cited by feature too. So 169 articles have been cited by this article that we're viewing right now. So that's a great resource to go in and look at. You can see we already have some free PMC articles that you can pop in. They also have a few terms down here. So if you're looking for synonyms for a search and you're not sure how PubMed might be classifying some things, you can go down and look at their medical subject heading terms that article is associated with and use those terms in your searches. We can also, I love this feature of PubMed. They have a citation feature. So we can do a format of AMA, APA, MLA, or NLM. You can copy that and post it or paste it into whatever document you're working in. I always give the caveat of making sure that we double check those citations because things do update and they might not update along with PubMed. So just double check to make sure your citations are correct. But I love the feature. So it's one of my favorite things to show off. So if we go back into our search results, I think that's pretty much everything about PubMed that I want to show you. Like I said, very basic, but it's a great resource. I'm going to open up the floor. Do we have any questions about PubMed while we're in here? Or Gina, if you think I missed something, because sometimes I do.
Is there a specific, I know you said not for the, where you create the one for the NCBI, but is there a specific sign in like through the University of Louisville Hospital for PubMed?
No, it's just the pubmed.com or .gov. That's all it is.
Okay, so as long as you're on like a computer associated with that, it should open all the resources that are available through U of L Health. Well, U of L Hospital.
Yeah. Pubmed.gov isn't affiliated with it. It's a free resource. So you can get it anywhere, even if you're at home or on your phone.
Oh, okay, gotcha.
Yep.
Thanks.
Great question. Anybody else? Okay. And if you do think of any other questions, we'll have questions at the end, or you can type it in chat. So I'm going to pop back into our little slideshow really fast, and we're going to finish up our presentation. So we just did our demo for PubMed. The next thing that I want to go over is our patient resources. So we do have a pretty broad range of patient resources that you can have for your patients. The one that we really want to focus on right now is Medlineplus. So this is a website from the National Library of Medicine, and it contains consumer-friendly information on health conditions, wellness, drugs, supplements, genetics, and more. They also have a few different versions in Spanish and additional languages. I love Medlineplus because it's general information, but it's also not written at a scientific level. I think it's written at a 6th grade reading level. I think it's middle school or grade school, and I can't remember which one it is off the top of my head. So it's very easy to read. It's easy for people to understand, and it gives great information. So I'm gonna just show you guys what PubMed looks like, or what Medlineplus looks like, and what resources you guys can use there. So this is what Medlineplus looks like. They have health topics, drugs, supplements, go into some genetics. They also have videos and tools. They have health videos, health check tools. Games are super fun if you're working with a pediatric patient, because they have these like fun little healthy eating for kids, Disaster Master for disaster preparation. So it's really fun just to get your patients more involved and to get them to know a little bit more about what's going on with them, or even just how to live a little bit more healthy lifestyle. You'll see up here, we also have that Spanish option too that we can switch into. And it takes you right to that, or you can switch back to English. You can also search into Medlineplus up here. So if you do diabetes, it gives us a whole bunch of information. So you can do it by medical tests, genetics, all of your filters or refines are over here. And you can also refine by format. You can also find some great consumer health information and patient information on the Roundtree website as well. And I'll pop into there really fast. So I've compiled a list of patient consumer health information for you guys right in here. So we have stuff from the American Health Association, CDC, Kids Health, Medlineplus is on there. If you forget what the name is, it is in there. We also have National Institute on Aging, and also some stuff for substance abuse, alcohol abuse. So great resource. So I just wanted to plug my little website there for a minute. And I'll pop back into our presentation. And this is pretty much the end. If you guys do need more help, unaffiliated researchers can visit Kornhauser Health Sciences Library to access our subscription-based resources. So Kornhauser is by the medical school on Preston Street. All you need to do is bring your ID and a mask. We are back on a mask mandate. And just check the website for current hours, especially since we're heading back into the madness. So just double check our hours and make sure that we're open. You can always come in, use their subscription services. So if you do need to find an article on PubMed, you can use the U of L subscription because you're logged in through their Wi-Fi, and you can get the article that way. Unaffiliated researchers can also come and visit me in Roundtree between the hours of 8 and 4. Hours are a little wonky sometimes because I do attend clinical meetings, so I'm not always in there, but you can also visit our Roundtree site, which I showed you just now, for any additional resources, free resources, anything like that. Roundtree was just upgraded quite considerably. So we have all new furniture, couches, computers, top of the line. It's really nice. So if you guys want to come in and visit, we'd love to have you. So, do we have any questions?
Just to clarify, if we came like physically to the Roundtree, we would have, like, we would do that to have access to all of the journals that that Kornhauser might have as well, or?
You would have access to what the hospital provides, and the hospital provides only CINAHL. To get access to all of the journals and articles and databases, you would have to go to Kornhauser Health Sciences Library for that information.